Hello, welcome to my channel. In this video we will talk about the most common systemic yeast infection symptoms. Often a systemic yeast infection can have minor symptoms, which is why it is dismissed as nothing to worry about. However, once the yeast enters the bloodstream, the symptoms of a systemic yeast infection quickly become very harmful and life-threatening. Your immune system usually contains a healthy amount of yeast in small amounts, and this yeast is beneficial to the body rather than causing problems. The body also contains many microorganisms that work to keep yeast growth limited so that an actual infection does not occur. Constant bouts of stress, unhealthy food, normal pregnancy changes, immunodeficiency diseases, antibiotic medications and other illnesses may destroy the microorganisms and thus allow symptoms of a systemic yeast infection to appear. Symptoms can vary from person to person, but here are some of the most common. 1. Regular feeling of tiredness and general malaise. A person with a systemic yeast infection will be tired all the time, have dizzy spells, have headaches, and have muscle aches, and may start to experience some sensory disturbance. 2. An unusual or sudden sensitivity to chemicals or a new food allergy. They can develop some sensitivities to food or other things that have not bothered them in the past. 3. Gastrointestinal disorders. Often the symptoms may be the cause of irregular GI. Also, food allergies, flatulence, inflammatory bowel disease, IBD, rectal itching, constipation, and diarrhea that may seem like upcoming problems may actually be symptoms of a systemic yeast infection. You can even develop a fungal infection that appears in the mouth or throat. 4. Genital or urinary problems. Others may have a seemingly persistent bout with vaginal yeast infection, when in fact they are already dealing with the symptoms of a systemic yeast infection, and either they don't realize it or they never treat it properly. 5. Sudden formation of rash or hives. You may have a case of hives, and you have no idea where it came from. 6. Suddenly feeling upset or mildly depressed. Some symptoms such as decreased attention span, memory loss, difficulty sleeping, difficulty concentrating, being in fog or mental confusion may also be classified as symptoms. 7. Problems with the autoimmune system. A person with an autoimmune disorder may find that the symptoms of their condition worsen. Some autoimmune disorders that usually become worse than systemic yeast infections are sarcoidosis, scleroderma, myasthenia gravis, arthritis, hemolytic anemia, thrombocytopenic purpura, or systemic lupus erythematosus. Symptoms of a systemic yeast infection seem to be more of a problem when the patient has higher stress levels and a persistently unhealthy diet. Yeast thrives in a body that is fed by sugar, refined starch, and chemical additives. These chemicals, starches, and sugars are also readily present in bread, crackers, chips, and other fast foods that make up a large part of many people's meals. When a person is under great stress, the microorganisms in the body responsible for yeast begin to die. What this translates to for you is that a terrible diet of sugary foods mixed with a very high level of stress means the perfect living condition for yeast. Since this yeast would have ideal conditions to thrive, a systemic infection could be on the horizon. Please, after you have finished watching the video, we advise you to look at the links in the description. There is something very important and useful waiting for you. Anytime you think you might have symptoms of a systemic yeast infection, you need to talk to your doctor about tests that should be done to determine your body level of the fungus. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about the most common systemic yeast infection symptoms, please visit my own site. You will find the website link in the description. Thank you.